AVN, or avascular necrosis, is a condition that affects the hip joint and can lead to severe pain and disability if not addressed early. It occurs when blood flow to the bone is disrupted, causing the bone tissue to die. This can happen for various reasons, including trauma, long-term use of corticosteroids, or excessive alcohol consumption. Let's break this down. Imagine your hip joint as a well-oiled machine. When blood supply is cut off, it's like removing the oil from that machine. The bone starts to weaken and can eventually collapse, leading to significant joint problems. AVN typically progresses through several stages. In the early stages, you might not even notice any symptoms. However, as the condition advances, you may experience mild pain in the groin or hip area, especially during weight-bearing activities. This pain can gradually intensify, becoming more persistent and affecting your daily life. In the later stages, the pain can become severe, and you might find it difficult to walk or perform simple tasks. The joint may also lose its range of motion, making activities like bending or twisting increasingly challenging. So, what can be done about AVN? Treatment options vary depending on the stage of the disease. In the early stages, conservative measures like rest, physical therapy, and medications to relieve pain and inflammation can be effective. Weight management and lifestyle changes are also crucial, as they can help reduce stress on the hip joint. As the condition progresses, more invasive treatments may be necessary. For some, core decompression surgery can be performed to relieve pressure and restore blood flow to the affected area. In more severe cases, a hip replacement might be the best option, allowing for a return to normal function and pain-free movement. Recovery from AVN can be a gradual process. After surgery, rehabilitation is key. Physical therapy plays a vital role in strengthening the muscles around the hip and improving flexibility. It's essential to follow your healthcare provider's recommendations and be patient with your progress. In conclusion, understanding AVN is crucial for early detection and effective treatment. If you experience persistent hip pain, don't hesitate to consult a healthcare professional. Early intervention can make a significant difference in your recovery and overall quality of life. Taking proactive steps today can help ensure a healthier tomorrow for your hip joint.